In a normal pregnancy, a fertilized egg travels down the fallopian tube and implants itself in the lining of the uterus, where it grows and develops into a baby. This is the ideal scenario for a healthy pregnancy. However, in an ectopic pregnancy, the fertilized egg implants outside the uterus, most often in the fallopian tube. This is a serious medical condition. This can also happen in the ovary, cervix, or abdomen. These locations are not suitable for the developing embryo. Imagine a tiny seed being planted in the wrong place. It struggles to grow and thrive. Just as a seed needs the right soil and conditions to flourish, a fertilized egg requires the nurturing environment of the uterus to grow. The uterus provides the necessary support and nutrients. When implanted outside the uterus, the egg cannot survive, and the growing tissue can cause serious complications. These complications can be severe and require immediate medical attention. Ectopic pregnancies are not viable and can be life-threatening if left untreated. The risks include internal bleeding and damage to reproductive organs. The fallopian tube and other areas outside the uterus are not designed to accommodate a growing embryo. They lack the space and necessary conditions. As the pregnancy progresses, it can cause the fallopian tube to rupture, leading to internal bleeding, severe pain, and potentially life-threatening complications. This is a medical emergency. Therefore, early diagnosis and treatment are paramount to protect the woman's health and future fertility. Timely intervention can prevent serious health issues and preserve the possibility of future pregnancies. Understanding the causes and risk factors associated with ectopic pregnancy is crucial for early detection and prevention. This knowledge can help in taking proactive measures to reduce the risk and ensure timely medical intervention. While the exact cause of ectopic pregnancy is not always clear, several factors can increase a woman's likelihood of experiencing this condition. These factors can vary widely and may often be interconnected. One of the primary risk factors is damage to the fallopian tubes. This damage can impede the normal passage of the fertilized egg. This damage can occur due to various reasons, such as a previous ectopic pregnancy, pelvic inflammatory disease (PID), or surgery involving the fallopian tubes. Each of these conditions can leave scarring or other forms of damage that affect the tube's function. Other factors that can contribute to ectopic pregnancy include smoking, endometriosis, certain fertility treatments, and even lifestyle choices. Smoking, for instance, can affect the health of the fallopian tubes and reproductive system, and the use of an intrauterine device, IUD. While IUDs are generally a safe and effective form of contraception, they can slightly increase the risk of ectopic pregnancy. It is important to have a thorough discussion with your healthcare provider about the risks and benefits of using an IUD, especially if you have other risk factors. It is important to note that having one or more of these risk factors does not guarantee an ectopic pregnancy. It merely increases the likelihood. Being aware of these factors can help in making informed decisions about your reproductive health. Early detection of ectopic pregnancy is crucial for effective treatment and minimizing potential complications. Being aware of the symptoms and seeking immediate medical attention if you suspect an ectopic pregnancy is essential. The most common symptom of an ectopic pregnancy is abdominal pain, which can range from mild cramping to severe, sharp pain. This pain may be localized to one side of the abdomen or felt throughout the pelvic area. Other symptoms include vaginal bleeding, which may be lighter or heavier than a normal period and may be accompanied by clots or tissue. Some women also experience shoulder tip pain, dizziness, or fainting, which can indicate internal bleeding. It is important to remember that these symptoms can also be associated with other conditions, so it is vital to consult a healthcare professional for an accurate diagnosis.